Now, let's dive deep into this big LGBTQ story for today. I'm Julio Capo, and let's queer up gay culture. 7 million queer elders are coming, and LGBTQ plus retirement communities are stepping up. By 2030, more than 7 million queer Americans over 50 will call the United States home, nearly double today's number. Yet many queer elders still face major challenges in aging with dignity. Discrimination from lawmakers, elder care staff, and healthcare systems continue to leave many without access to gender-affirming or culturally competent care. Because of these inequities, queer seniors experience higher rates of depression, dementia, and chronic illness, making inclusive housing more urgent than ever. And the need is personal. LGBTQ plus elders are twice as likely to live alone and 4 times less likely to have children than their straight peers. According to SAGE, that's Services and Advocacy for GLBT Elders, queer seniors have been denied shared rooms with partners or told to hide their identities in care facilities. Quote, "The fear of going back in the closet remains a real and painful possibility," end quote. To counter that, LGBTQ plus affirming retirement communities are emerging nationwide, offering safe, inclusive environments, staff trained in affirming language and care, and spaces for belonging. Among them are the Connie House in Boynton Beach, Florida, and the Palms of Manasota in Palmetto, Florida. And even if not all queer elders can access these havens, support networks like National Resource Center and LGBT Aging and SAGE connect seniors to inclusive housing and care options. I have to say, this is something as a historian that I think about a lot, right? Because we see so many different generations of some version of the story, and it's all fairly recent, right? Because that is, we think about kind of course, queer people have existed across space and time forever. But the idea of like a gay identity is somewhat new, right? So like that is, 1940s into the 50s really in earnest when people start more identifying as gay and lesbian, and there's like these kind of identities that are clearly formed. And then, as a result of what happens with HIV/AIDS beginning in the 1980s, we lost so many people at an early age. So the kind of idea of aging elders in such large numbers in some ways is a really new and unprecedented thing that we haven't dealt with all that much since really the 1990s, right? Like that's when we start seeing it happen the most. And lots of places, including where we, nearby where we are right now to Wilton Manors, have kind of become these gayborhoods that often court and have housing available. But the problem remains they are so expensive. And they really are just, and of course these are the housing facilities that are available in these kinds of spaces where you can find a gay doctor, where you can find a gay, and they're just so difficult to access.